Yeah, so I think I'm here today to be the example of a patient organisation involved in a registry but not there yet. And when you hear Chris talking, there's no question about the value of registries and the importance of them. But I certainly found it difficult to make that jump between knowing the theory of that and actually getting to a real life registry. And I'm not there yet, but we have learned a lot along the way, and I hope that some of that will be relevant to you. Just to explain a little bit about my own personal motivation, because I know those bios go straight over your head. For a long time I've also been concerned about what happens when genetics doesn't go to plan as such, and what we can do about that. And so that led me to my time in a lab doing research for many years. My claim to fame from that time was that I found a gene for a form of blindness, but it doesn't really come in very useful at dinner parties. Nobody says, "Oh, you're the one," And now, as Flora said, I work for the patient organisation DEBRA Ireland, and I work a lot with DEBRA International as well. And I'm really actually lucky to have Eleanor here today, because we work closely together. Eleanor's from DEBRA UK. So in DEBRA, we've been focused for quite some time on the idea of a patient registry. What are reasons for that? Well, actually, Chris gave a great introduction to all the many reasons that you would want to do that. From our perspective, Casey is really invisible in the system. So she has her doctors who learn things about her all the time, and in doing so learn things about EB, but that information doesn't filter through anywhere. Part of the reason for that is, in Ireland at least, you're probably a little bit better here, everything is still paper records, so there's no way to use that, and that is one of the reasons we want to have an IT platform that will underpin care in Ireland. One of the major reasons for us as well is the accessibility to clinical trials for Casey, and the ease at which clinical trials can happen. So there's so many reasons. Certainly for us, that's one of the key ones, and I think it's very helpful to be clear on what your major reasons are. Now, we wanted to go on and do all sorts of other things eventually as well, but that will sort of guide us at the start, I hope. We also want to know how Casey's faring relative to her counterparts in other countries. At the moment, we really don't know that information. There's so much we don't know about her aspects of her care and the best care pathway for her, and whether or not the clinical practice guidance that we're working on are helping her. So we want to be able to set her in a broader context. And very importantly as well, we want to eventually, and this is down the line, but we hope that there will be a patient portal aspect to the registry, where her parents can get onto their mobile phone and look at her data themselves, and do all sorts of other things in there. So we do want to get away from this sort of paternalistic approach to medicine, where patients can have true involvement in their own condition, in management of their own condition. So it's not that we haven't had any registries before, we have. And some of the examples are, this one was a registry in the States that was actually really successful. I think it ran for 20 years, and a lot of what we know about EB now came from that registry. But it hasn't continued because of resource issues. And then there's this database, more of a database collecting information on one form of EB and the mutations, the many mutations that can cause that. And that's of great value, but it's slightly different to the sort of registry that we're thinking about. And then, going back a few years ago, we were very excited because we thought we had finally made some progress, and we were starting this registry called EB Care. And it was a patient-led registry, so patients were going to put their own information into it. And it was funded by a pharmaceutical company, but it was going to be governed by DEBRA, so it was quite a nice model. Unfortunately, it didn't work out. A lot of people feel that patient-led registries are not the way to go, or that a database is not the way to go. Personally, I don't buy that. I think if you're collecting information in a way that has been well thought out, and you're using that information appropriately, data is always valuable. So we were a bit stuck, I think it's fair to say, and as I said, different pockets of registries around Europe and beyond, but nothing that was linking things together. And then one of those very, very rare things happened, and a fairy godmother came along. Our fairy godmother is in the form of the Irish Skin Foundation. So the Skin Foundation are a very forward-thinking and dynamic organisation, And one of the things they've looked at doing is to develop a patient register. And these two gentlemen here, Alan is one of the leaders of that project, and Dimitri was employed by them. Dimitri is, they're both dermatologists. Dimitri also has expertise in health informatics. So he was the perfect person to get involved in this, and the Irish Skin Foundation employed him, and he spent, I think, 3 years working on a plan. So to look initially, was it worthwhile developing a registry, and if so, how you would best do that. And I had the good fortune to link with him fairly early on, and through multiple conversations we arrived at a point where they committed to for at least a portion of the registry to focus on EB, which was very, very welcome to us indeed. And so I realised that, you know, that might be a little bit hard to relate to. These things don't usually happen, but by being sort of led through the journey by their expertise, it has made me realise that it would have been possible for us. It would have been harder for sure, but it would have been possible for us to push ahead and create something that was international in a way that I didn't think was possible. And actually, there's another European project called Parent, which is focused on registries and particularly cross-border registries, and they have a very, very in-depth guideline on how you develop a registry. Alan and Dimitri actually wrote a chapter in that. If anybody's on Twitter, I tweeted a link to it earlier. Maybe it's something that could be shared, Flora. So this is, I'm not going to go into a huge amount of detail on what exactly the registry is going to look like, but this is the broad picture. So in our case, it will be clinically led. And I should say that it's really two projects in one in a way. So we're developing a so-called clinical platform for Ireland, and because we're moving from patient records, that's fairly straightforward. From paper records, that's fairly straightforward to do. Okay, I hope. So we're putting that in place, but in parallel, we're working to make sure that we'll be able to connect the registries around Europe, so that we will have a network of registries. So the data will be collected by the nurses and doctors through the clinical portal. We will hopefully establish the network of registries. Very importantly as well, we're not looking to replace registries that already exist. And there are ways to do that technically now, to link in registries that already exist. And I think that's a really important point actually, because otherwise you come up against all sorts of barriers. We will hopefully, in Ireland at least, be collecting quite a bit of information, and there's lots of countries and centres out there who have no registry at the moment, so they will be able to adopt that IT platform should they wish. And because the Irish Skin Foundation are funding the initial cost, that will be very helpful to them. But all registries involved in the network will hopefully submit data centrally. Now initially it will be small amounts of data, but that will be the start of allowing us to get together the information, say, for clinical trials. It will use something called OpenAir in its development. Okay, so there's always part of the talk where you're really not qualified to talk about, and that's definitely it. But OpenAir, as I understand it, is a type of clinical modelling, which translates the language of the clinic to the software language, and however that works exactly, allows sharing afterwards. So again, in that chapter in the parent guidelines, there's details on how OpenAir works. And the software developers that we're using are called OpenApp. We're very comfortable with them. They have great experience in this area. They're managing the Cystic Fibrosis European Registry. So what's our role in this? So I think our role so far is really quite straightforward, but very, very important. We're really the linchpin in all of this. We pull all the different stakeholders together, and actually I feel really passionately, I suppose, about that role of patient organisations in general. I think there's so much that we can do because of our connections, so much we can do in bringing people together, and also we tend to be trusted as organisations, and that's enormous as well. Actually, it's huge value in that. So we're bringing together obviously the patients, and very importantly bringing the patient perspective to it. That we have very strong connections with all the clinical leaders around Europe. The ERN skin is going to be really important in this as well, and we're linked in there. I sit on the patient advisory group for that. The software developers, and of course the Irish Skin Foundation. So we had to, so we have the connections and we have the trust, which is great, but we had to really get things moving on, and the way we felt that was best to do that was to get everybody in a room together, and that's exactly what we did. All those stakeholders that I mentioned, we brought them together, and there was huge advantage in just having everybody sit down and talk about what they wanted from a registry. We also had various experts in registry development there who were able to explain to us what was possible and what was not. And the software developers, and that sort of connection between the software people and the clinical people is so important as well. We were really, really lucky with this meeting actually. It was, we gave people very little notice, and almost everybody came. So it was just one of those things that came together for us. And what we really wanted out of the day was we wanted everybody to agree to send us the data sets that they're currently using for those centres that already have registries. And now what we're doing with that is we're doing a mapping exercise. So we're looking across them all and seeing what do people collect that's in common with each other. And from that, we're then going to pull out a so-called common core data set, which will be very small actually. It will be genetics, diagnosis, demographics, healthcare provider, maybe a couple of other things that will be really quite small. And that will be our starting point for the sharing that comes later. And that's where we're at the moment actually, working on developing that core data set, and then we will go back to people and hopefully get some consensus on that, and from that develop a governance group and so on. Loads of challenges along the way, as you might imagine. Politics, of course, there's always politics. But again, I think the trust of the patient organisation is really important there. And we've been able to overcome by really just reminding them what's at stake here, what's important, and that's worked up till now. Language barriers, and I don't mean English and French, I mean the language barriers between the technology people and the clinical people. And personally, I found that an enormous barrier. I'm one of those people who likes to really understand something when I'm working on it, and I've had to accept in a way that I'll never fully understand the technology aspects of it, and to accept that that's probably okay, and maybe I don't need to. But even, I was talking about developing a common data set. There's so many terms just for that alone: core data set, reporting data set, minimal data set, and it took me a long time to realise that there's slight differences, but they're essentially all the same thing. And I think as a community, I think that's something really important actually that we need to think about, because otherwise there are too many barriers for patient organisations getting involved. The roadmap is not completely clear. Of course, that's the same with a lot of projects, especially international projects that you're involved in, but it's a challenge nonetheless, particularly around the ERN and how this project is going to fit in with the ERN. So we had representatives from the ERN at our meeting, and we keep them informed along the way, but how exactly is that going to work? I don't know yet. And resources, of course, that won't be any surprise to any of you either. At the moment, we're putting so far no money in, just a little bit of my time, but that's not going to work in the longer term. Having said that, I have found in the past, and I'm hoping this works again, that if you have a really strong plan that you really believe in and you can communicate that to people, then the money will be found some way. So I'm hoping that once again that will work. Lots of positives as well. I think our timing was really good. I think the EB community in particular were ready. And there've been a lot of frustration and a lot of lack of progress, a lot of failed funding applications, and I think that's a big part of the reason they all came to Dublin and got together. Related to that as well, I think the timing in terms of best practice around registry development, it seems to me that the conversations are a little bit more straightforward now. When you talk about data protection, when you talk about interoperability, the answer is shorter. It's yes, we can do that, this is how. In a way that maybe it wasn't even going back a few years ago. The classification of EB, it's an important thing. We've got good understanding of all the many subtypes of EB, and a lot of work has gone into that classification, which will obviously be very important when it comes to capturing information on the diagnosis. And we obviously have the startup funding from the Skin Foundation, which has no doubt been very, very helpful as well. So looking to the future, the big things that are on my mind at the moment are the governance. How are we going to handle that? At the moment, I'm thinking we'll probably establish some sort of working group within DEBRA International to be very, very clear on what the patient organisation wants out of this. And then our thinking is that we're going to pull in representatives from all the centres that are going to be involved into some sort of governance group. But it's definitely something we need to work on. As I mentioned, how exactly do we align with the ERN skin? And I think there's a possibility of funding coming up for approved ERNs for registries. But are we going to be ready to apply for that? I'm not sure. And funding models will be important in the future as well. And yeah, I'm really not qualified to speak on that yet, but we'll be looking into possibility of industry funding and making the registry worthwhile, useful to everybody, in the hope that there are funding models that can then apply. That's a picture of my daughter actually taken this time last year. It always makes me smile because it's lovely and hopeful. But some parting thoughts. The registry, I think the registry has to be useful to everybody who's involved. So if you're expecting a specialist nurse or a doctor to sit down and take time out of their hectic day to put in some information, there has to be some value in that for them. And it's the same with everybody who's involved. And if you're looking down the line towards industry funding, well then maybe it has to be designed so that you can undertake clinical trials from within it as part of it. The platform should be flexible and should allow growth. So the approach using this clinical modelling open air seems to allow for that. And no doubt there are other ways to do that as well, but I think it's an important question when you're talking to software providers. One thing that's made me a little bit more comfortable with the whole thing as well is it does seem now that it's possible to develop something in stages. It used to feel like you had to do a sort of all or nothing approach. And I think that was a big barrier for us, you know, that everybody who was going to be involved in Europe had to be involved from the start. We had to know exactly what we wanted. And it was, all the information in from the start. And it seems like that's no longer the case. I think you can start smaller now and build on it as you go, which makes it very much more feasible. Again, maybe this is just me, but I did struggle with that, not understanding all the different aspects behind it, and I have had to accept that that's not going to happen. But hopefully, if you get the right people involved, you're going to have to put your trust in them, and hopefully that's enough. And the trust in the patient organisation is absolutely key. I don't think that can be overstated. So I think that's everything. Thank you for listening, and thanks to Findacure for having me today, and of course the Irish Skin Foundation and all the EB community.